Hello, and thank you for joining us in another exciting webinar series of Senior Health Medicare. Today I have Cameron Giardini and Trevor Patch here to talk about Medicare Supplement Plan F versus Plan G. So without further ado, I'll let you guys take it away.
Hello, everyone. I'm Cameron.
And I'm Trevor.
And like Courtney said, we're going to talk about the differences between Plan F and Plan G when it comes to Medicare supplements. So throughout this, Trevor's probably going to hit on Plan F a little bit more in detail, and I will talk about Plan G. So with that being said, let's get into this.
Okay, so we go over these things multiple times a day. And the reason for that is because the two most popular plans out there are the Plan F and Plan G. The reason why Plan F is very eye-appealing is because it has 100% coverage along with your Medicare. You pay your monthly premium, and after that, you should not get a bill. There's a couple things that are different between a Plan G and a Plan F, and I think after this webinar, we would like to maybe convince you going with the Plan G over a Plan F.
I'd have to agree with that. So like Trevor said, these are definitely the most popular plans out there. Plan F has been the most popular for a long time, but we are really seeing a shift in the industry towards the Plan G, and we're going to go over the details as to why a Plan G is probably right for you.
Probably one of the biggest differences, and really the main difference between an F and G, is the Plan F has no deductible. Like I said before, you pay your monthly premium and you're all set to go. Whereas a Plan G, the same exact coverage, except you are responsible for the Medicare Part B deductible. In 2017, this deductible is on an annual basis, and it's $183. Once you meet that, your Plan G is going to be acting the same way as a Plan F does. Like I said, once you meet that, then you're all set to go.
Yeah, and like Trevor said, it's really important to remember the Part B deductible, and that's B as in boy. It's standardized by Medicare, so every company offers the exact same Part B deductible, and it's an annual deductible. So once you meet that, you're done for the year. You don't have any other out-of-pocket expenses for the Plan G. It acts just like the Plan F. So this year, the deductible is $183. And that is subject to change. It doesn't change too much, usually about $10 to $15 per year, whereas last year, for example, it was $166. The year before, it was $147, but it could even go down. So just know it does change, but it's always going to be the same for each company. And once you meet that deductible for the Plan G, your benefits are the exact same as the Plan F.
Another thing that comes along with that, if you think about it, essentially with the Plan F, the insurance company is paying your Medicare Part B deductible for you. Okay, so with that being said, they're probably usually going to be charging you more in your monthly premium to do so. On average, the difference between an F and G premium-wise is around $300 more per year. So I would much rather see my clients make this decision of going with the Plan G and roughly save a couple $100 every year.
Yeah, at Senior Health Medicare, when we get all these calls coming in every day, they talk about the rates for both. They always say, will I get a rate for a Plan G? Can I get a rate for a Plan F? And oftentimes when I talk to clients, the rate comes out to, like you said, about $300 difference. So $80 a month for a Plan G, for example, and then $110 for a Plan F. And the only difference when you really look at it is $183. So you're just paying the insurance company a higher premium so they cover the deductible for you. That's really the main difference between the two plans. Other than that, they each cover the exact same procedures. They have the same benefits, so they're all going to cover the 20% that Medicare does not cover. No plan is going to offer additional benefits like dental, vision, hearing. It doesn't matter what plan. You just got to look at the actual premium and the benefits. So.
Another thing that you got to look at is when you go with either plan, you can go to the same doctor. Your network or lack of network, you basically can go anywhere in the United States with these plans as long as Medicare gets the bill. It doesn't matter. You can go to either plan, and have the same doctor. So if you decide to switch, if you have a Plan F currently and you want to go to a Plan G, that's one less thing you have to be concerned with. Your doctor will still accept the Plan G just as much as the Plan F.
Yeah, absolutely. And I think we can go to one of the questions we actually have in regards to that. So we can hit more on some audience questions here.
Sure, yeah. There's a question from the audience that says, will switching from F to G affect the doctor's ID? So exactly what you guys were just talking about.
Yeah, and that's pretty much what Trevor just hit on, which is a really good point. Your doctors will not change with these supplements. If you go from an F to a G, even a G to an F, you're not going to change your doctors. Anyone that takes Medicare will take these supplements. It doesn't matter what company, if it's Blue Cross, Bankers Fidelity, New Era Life, as long as they take Medicare, they'll take the supplement. I know some of our other webinars have hit on how to pick the right company, so it's really important to look at that. But just know that you will be all taken care of no matter what plan you go with. And another thing, we can get a little bit more into the details of Plan F, and I know Trevor can hit on it too. But one thing that people really need to look at is the big changes coming with Plan F. So, Trevor, if you want to talk a little bit more about that, we can get into that.
Yeah, so there's a huge change coming into Plan F, the high deductible F, and even Plan C in the year 2020. What's going to happen is all three of these plans are going to be kind of phased out, as in it's no longer going to be offered for new enrollments. If you already have one of these plans, you get to keep it. You're going to be grandfathered in. But what's going to happen is, with no new enrollments coming in, well, everyone who's healthy enough and can switch, they probably will. Everyone who's unfortunate to have a pre-existing condition and can't pass medical underwriting to switch to a different plan, they're going to be essentially stuck if they want to keep the coverage. What's going to happen with these people is they're going to get older, they're going to get sicker, and they're going to be making more claims. So with that being said, your premiums are going to skyrocket because the new enrollments are really what kind of keep the premiums as low as they are today. So this is why we definitely recommend that you review with Senior Health Medicare to look into a Plan G, because there's no changes coming into Plan G as far as we know right now. So that's huge. So give us a call and we can definitely review and see if a Plan G would be a better option for you.
Yeah, like Trevor said, the pre-existing conditions are a huge thing to think about. You always want to check and see what you can do now as far as switching plans, because trying a new plan, a Plan G, will not affect your current plan. If you want to go through an application to at least see if you can qualify for a Plan G, there's absolutely no penalty to you. We can always fill out an application. It's no obligation, really, and we can at least make sure that you have the ability to switch ahead of time. And even with that being said, I know Plan G or Plan F has some really big changes in 2020, but even right now, Plan G is the better option, because Plan F is one of the guaranteed issue plans, and it is one of the plans where a pool of people that are on the plan tend to be a little bit less healthy. So with a guaranteed issue plan, anyone with any condition can have access to the plan if they have a special election period. What those usually are that you're losing your coverage, if you're moving out of your service area, you have access to a Plan F as it is, no matter what. If you have COPD, if you have renal failure, it really doesn't matter. You can get a Plan F. So Plan G does not have guaranteed issue access, meaning that people who have Plan G tend to be a little bit healthier. They have less claims, and with that, there's less rate increase associated with the Plan G. And that deductible also deters some other people who may go to the doctor often. That's why people gravitate towards Plan G if they don't have as many bills, if they don't have as many medical issues. And that's exactly why the government is phasing out Plan F in 2020. They think that getting rid of that deductible or stopping the coverage for the deductible will make people have more skin in the game, and it will make them gravitate towards the Plan G, and it will also make them stop overspending on their health care. If Trevor wants to hit on that too.
Yeah, so the reason why it's important to kind of stay away from a Plan F as far as the guaranteed issue goes, with these people that are getting these guaranteed issue plans, like Cameron said, with the people with COPD or the cancer or anything like that, the biggest things that come into factor when it comes to rate changes are, well, claims and inflation. Can't really change anything about inflation. That's going to happen no matter what. But claims can kind of be controlled by answering health questions with some of these certain companies and going with a Plan G. So if you go into a pool of people that is unhealthy and they're making a lot of claims, well, that's going to affect your rate as well.
Yeah, is exactly right. Really, claims is a measure of profit. The less claims that a company has, the more it's profiting. They don't want to spend anything more than they have to. So if you can keep the claims rate low, like a Plan G, it's always going to be good for their bottom line and your bottom line. Because if a company does well, it means that they're not increasing your rates, and it means everyone's doing well. So I think we have another question.
Yeah, we have a couple questions that came in. Mary from North Carolina wants to know, she says she's turning 65, and her neighbor told her that Plan F was the Cadillac plan. She says that she should buy it while she can. What do you guys think about that?
Well, I believe in one of the other webinars, someone said that you don't always want to listen to your neighbor. The reason for that is because not everyone's situation is the same. Mary's neighbor could be in a totally different situation than she is. Well, with Plan F, yeah, you can buy it now, but that doesn't necessarily mean you should. With it going away, like we mentioned before, with it going away in 2020, your rates are really going to skyrocket with what's going to happen as it's phased out and no new enrollments are coming in. So yes, you can buy it now, but do we recommend it? No.
Yeah, and Mary, your neighbor is totally correct. It was the Cadillac plan. It was the gold standard, and Plan F covered everything. There was no issue, but that all changed once it was going to be phased out in 2020. So just make sure that you're not overpaying for that plan to come. You don't want your Cadillac to turn into a Ferrari when it comes to cost.
Okay, awesome. So Barry from Indiana says, 2020 is a long way away, and my rates are just fine with Plan F. So why would I switch?
Well, Barry, that's a really good question. Your rates are good now, but it comes down to if you're healthy now. You don't get a letter in the mail when you're going to get sick, right? You don't know when something's going to happen. So if you're healthy now, you know Plan F is going away in 3 years. So we would recommend that you at least try to get into a plan that's going to stick around a lot longer than 3 years. So when that does happen and you hit your rate increases, what we don't want to see is you stick on that Plan F and you get diagnosed with something and you can't switch, and then you're stuck paying for, well, like Cameron said, a Ferrari for a Cadillac.
Yeah, and Barry, Trevor makes a really good point when it comes to health and not knowing what's going to happen. You know, here at Senior Health Medicare, we deal with clients all the time, and I've talked to people where they were going through underwriting trying to get a plan, and I had a lady, she actually tripped over her dog, and she broke her hip, and we had to cancel her application. So things can happen like that. It doesn't matter if you're healthy now, you could have a freak accident just like that, and you might not be able to qualify for the Plan G. And another thing, 2020 is not that far away. It's only 2 years away at this point, you know, give or take a couple months. So it's really something to look at now. It's very easy to go through an application process. Everything takes about 10 to 15 minutes. The hardest part is we have to ask you a couple health questions, only about 10 of them, which takes a few minutes. So as long as you have 15 minutes, you can always give us a call and we can see if you qualify for the better plans out there.
Awesome. Well, thank you, Sam and Trevor. We touched on a couple of topics: special election periods, underwriting, choosing a Medicare supplement company. We have other webinars that are specifically diving into those topics, so be sure to check those out on our website, www.seniorhealthmedicare.com. And thank you for joining us today.
The moderator has left the conference.